Hello, my name is Josh Anderson, and this is my video demonstration on completing a skin assessment for a patient. To begin, I would introduce myself to the patient. I would ensure the patient has privacy during the assessment, and I would perform hand hygiene. Hello, my name is Josh. I'm going to be your nurse today. We'll just be completing our skin assessment here. I'd verify the patient's first and last name and birthday. To begin the skin assessment, I'm going to be taking and looking at the patient's face. I would be noting any additional rashes or skin discolorations. Be using a pen light to check darkened areas such as behind the ears. I would discuss with the patient any history that they may have with any rashes or skin issues along with their family history. Upon seeing no rashes or discolorations, I would then move down to the patient's upper body. I would inspect the patient's chest and abdomen for any new rashes or discolorations. I would then check the patient's skin turgor. To do that, I would lightly pinch just below the clavicle, and I would just talk to the patient through this. So I'm just going to take and do a light pinch here up on your upper chest. For this, I would be checking the patient's skin turgor, noting if there's any tenting of the skin where it remains pinched after I let go. I would then take and feel the patient's upper extremities. I'm just going to feel your arms here. While I'm doing this, I'm noting that the patient's arms are warm and dry to the touch, and I'm going to be checking to see if there's any edema, which I do not feel any. I would continue the assessment down to their lower extremities. Again, assessing to see if there's any discoloration on the lower extremities. Seeing none, I would lightly feel the extremities as well. Just going to take and feel our legs here. I note that the lower extremities are warm and dry to the touch. I would also be feeling to see if there's any depression for edema, noting none. We would check the patient's capillary refills by lightly pinching on their toes, noticing that there's the white will disappear within less than 3 seconds. And we would do the same thing to their fingers. We note that is normal. To inspect the patient's back, we're going to have them roll onto their side. We would assist them with that. We'd be checking the patient's back here, paying attention to areas that they have bony prominences in contact with the bed frequently. Upon inspection, we notice that there is a small reddened area on the patient's coccyx that is non-blanchable to the touch. We would get a measurement of this, noting it approximately 2 centimeters. We notice that this would be signs of a stage 1 pressure ulcer developing. To help treat this, we would place a foam dressing on the area, and then we would reposition the patient every 2 hours, along with keeping the head of the bed below 30 degrees to prevent this from developing further. To do this, we would place the patient slightly on their side here. And we would cover the patient back up. This would conclude our assessment for their skin, and then we would just document our findings.